A new study shows surgeons are paid less for procedures on female patients. The Toronto-based study was published in the Canadian Journal of Surgery. It found that doctors are compensated 28% less on average for operations on women than similar procedures on men. Now, researchers found surgeries on male reproductive organs are often priced higher, even if the procedures are less difficult to perform. Joining us now for more is Dr. Andrea Simpson, an OBGYN and minimally invasive surgeon at St. Michael's Hospital. First of all, Dr. Simpson, thank you so much for taking the time today to join us. Are you surprised by the results of this study?
Thanks so much for asking me to come and speak on this important topic. I'm not surprised by this study. I have been involved in some research in the past that has looked at reimbursement for male and female surgeons per hour spent operating. And in that study, we did find that female surgeons made significantly less than male surgeons. And that finding was largely explained by the majority of female surgeons being gynecologists.
Right, and so you're bringing up a point that is in addition to the, it's being called surgical sexism in Canada, that not only are surgeons paid less for operating on female patients, but also that female surgeons themselves are making less than their male counterparts. Talk to us a little bit about why you think the former is happening. Why do you think that doctors are being paid less for operating on women?
So it's difficult to know all of the reasons why decisions go into how procedures are reimbursed. What I do think is really exciting about this study is that it does sort of pave the way forward. If we can look at these equivalent procedures between male and female patients, perhaps we can adjust the reimbursement to ensure that we make things equitable for male and female patients.
I do want to ask you about how this filters down to the patient, though. I mean, one would, as a patient, be concerned that possibly, I might not get the same treatment that a man would get because I'm a woman, because the doctor's not getting paid as much to do certain procedures on me. So is there any implication in terms of the quality of care that women are receiving and their health outcomes?
Yeah, so I think that there is. There is a term that was first used by a U.S. researcher called double discrimination. And this describes, so if we are paid less for procedures on female patients, a lot of physicians like myself who practice both obstetrics and gynecology may have to spend more of their time practicing obstetrics, which does reimburse a little bit better than gynecologic surgery. And what that can do on a population level is lead to a lot of low volume gynecologic surgeons. And there's good evidence to show that low volume surgeons have less favorable outcomes than high volume surgeons. So if we want to promote more high volume gynecologic surgeons, then I do think that the reimbursement needs to be adjusted and looked at.
What do you think in terms of what needs to be done in order to change what is happening? I mean, clearly there are impacts for hospital staff, but also for patients.
So I think, first of all, this was shown in multiple provinces across Canada. So this is not not unique to any individual province. So these procedures that were looked at in this study are specific to male patients and female patients. So I think the first thing that could be done is just to use these procedures and make amendments to the way that they are reimbursed to ensure that there is equity for male and female patients. I think that would probably be a very good starting point.
And do you think that there is an appetite to make these changes when it comes to provincial governments?
So I don't know all of the ins and outs of how these are decided at a higher level, but I would say that we have a good body of data now. It is undeniable that we are seeing inequities in the way that surgeries on male and female patients are being paid, and that this is an important issue that should be prioritized by leadership.
Yeah, it's an alarming study. Okay. Dr. Andrea Simpson, thank you so much for taking the time.
Thanks so much.